Hi all, how are you? I know it's corona time and you guys are all, scared, but now slowly things are moving ahead. People have started going to their workplaces and the lockdowns are getting lifted up and things are getting back to the normal. But at the same time, people have this fear that something wrong should not happen again, people should not get infected again. We had lots of questions, and with ms, of course, our concerns become more than ever. It becomes more scary than ever. Well, I would like to say that for the first time we're going to have a neurologist here with us today, Dr. Mateus. He's from Brazil, and he is I spoke to him for 30 minutes yesterday, and oh my god, I was super impressed by his brilliance, the kind of knowledge he has, and he cleared a lot of misconceptions and a lot of new updates he gave me, and I was like zapped with it, with the knowledge he has. And I'm very glad to invite him here with and introduce you all to Miss Dr. Matthews, because we need to share the new knowledge of ms, how ms is affecting all of us, and how ms really has advanced in all these years. So, well, I am gonna invite Dr. Matthews without any more time. I've sent you the request, Dr. Matthews. Hi, Doctor. Hola. I have to greet you this way.
Hola, hello.
Hola.
How are you doing?
I love that. So, how is your day going?
No, I am well. Today it's a sunny day here in Brazil, in São Paulo. And let's go to our nice life. And how are you?
Oh, I'm doing
It's 10 p.m. there?
Yes, it's 9:30 p.m. here.
Oh, okay.
Yeah, it's already night for me here.
Yes,
So,
yes, a big difference between
yeah,
us.
I was telling everybody that I had a brief session with you yesterday, and I was amazed by the kind of knowledge you have and the new updates you gave me about MS. And I would love it if you share the same with everybody here.
Oh,
Everybody
thank you very
watching us
much.
are all my friends, and I can see my family. I've known them for years now. I know each of them, and I'm very glad to introduce you to them for the first time.
Okay.
So,
Oh,
Doctor,
sorry.
before we proceed, would you like to say something about yourself, what all you have been doing, and everything about yourself?
Yes, sure. First of all, thank you so much for your invitation.
Yeah,
It's a pleasure to be here to talk about multiple sclerosis. It's a topic that I really love to talk. And congratulations on your initiative on increasing awareness on MS. And I hope to be able to answer all your questions and doubts and share some of my experience. Okay, as you asked me to introduce myself, my name is Mateus Boaventura. I am a neurologist specialized in MS and neuroimmunology. Currently, I work and live here in São Paulo, and I have been doing some research on MS and MRI, not only in Brazil, but also in Spain, where I concluded my fellowship last year. And thanks again for your invitation.
The pleasure is all mine. Thank you, Doctor.
It's mine.
So, Doctor, I can see a lot of people here and they are waiting for us to start the session. So let's start with the questions. I would first like you to explain us the basics. What is MS? And yesterday you told me, you opened my eyes. You said now we do not have 4 types of MS. Now we talk about only 3 types of MS. So can you explain a little about this, please?
Yes. When we describe MS, we have many different ways to describe it. First, we have, in technical words, we can describe as a chronic disease that affects mainly a young woman and is an autoimmune disease that has 2 main mechanisms. We have inflammation and In other side, you have neurodegeneration. But that is in technical words. If I say in a more simple way, in a different way from we find on books, I could explain about, for example, first our immune system. Our immune system that should protect us against virus or bacteria, that same immune system and can get confused itself and start to attack our central nervous system. That is made up our brain, our optic nerve, and our spinal cord. And inside the central nervous system, as you know, we have the main target that is called myelin.
Myelin sheath.
And myelin is fat material that cover the neurons and makes the electric message to pass over quickly, more quickly. And this kind of communication makes us, for example, do correctly movements, to have some thoughts, to have correct coordination. And when we lose myelin, we have what we call demyelination. And depending on the area, we have some kind of lesion of inflammation, we can have symptoms. For example, if the lesion is inside your optic nerve, you can have an optic neuritis. That is characterized, that is characterized, for example, you can have a vision loss, you can have a pain on movement eyes, you can have difficulty in, for example, identifying some kind of colors, mainly red and green. And that is, for example, a kind of relapse. That visual symptoms in general, for example, will last from days to weeks, and after you can recover spontaneously because the myelin will be remade for your own body. That is good on the beginning of the disease. And that recovery we call remission. But in other case, in other patients, we can have other kind of mechanism that is called degeneration. In that kind, the own neurons can die. I mean, you can lose the actual nerve fiber, not only the myelin that protects the nerve, but the own nerve. And that kind is more common on progressive disease. So that is MS, is autoimmune that you can have or inflammation or neurodegeneration or both occur in the same patients. We have different kinds of phenotypes that we can explain in other questions, and it's much more common in young women, but it's such a heterogeneous disease that can affect in a different way from patient to patient.
And what are the three kinds of MS that we talk about right now to name?
Okay. We can classify the MS according to the way MS affects you, according the manifestation. For example, if you start with a relapse, or I can say with an episode of a new neurological symptom, and that symptom worsen over some days or weeks, you have a relapse. After that, you can have a recovery, as I have said, and that recovery is called remission. Yes, and depending on the activity of your disease or your activity profile that you call, you can have, for example, a low number of relapse a year, or you can have a high number of relapse a year. And this first type is called relapsing remitting MS or
RRMS.
RRMS. Yes,
Yes.
that is the most common. It
Yes.
affects 85% of patients worldwide, and is is characterized by more inflammation than degeneration.
Okay. Okay.
That is the first one, relapse
Right.
remitting MS.
RRMS. Yes.
And the second one is the primary progressive MS.
Right.
It's different.
Yes.
About 10% of patients start with this kind of phenotype. And the way is the patient starts to worsen slowly. For example, the patient will complain to you about difficulty in walking
Yes.
or difficulty, for example, in coordination, in their speech, for example, a slurred speech. And the
Right.
patient cannot identify the exact time that the symptoms have started. It's
Okay.
different, for example, from relapse remitting MS, where the patient knows when the first symptom is started. And in progressive MS, in primary progressive MS or PPMS, we have more a mechanism of degeneration.
Okay.
And that is the second one type, the second
Right.
one phenotype.
Right.
And the third phenotype we have is the secondary progressive MS.
Okay.
In that phenotype, we start with relapse. We
Right.
can have, for example, many years of relapse and remissions. And depending on the patient, after some years, the patient can evolve to a progressive form. For example, the patient can evolve with no recovery and with a slow progression, with a slow worsening of symptoms.
Okay.
After that, the patient can present relapse yet, but can overlap both progression and relapse.
Okay.
And one information that is important to emphasize is that before the treatment era, before the 90s, the first drug that was approved in
Yeah.
1993, beta interferon,
Okay.
50% of patients with relapse remitting MS evolved to SPMS, to secondary progressive MS, after 10 years.
Okay.
But now we have more than 10 options of treatment, and this situation is totally different. So we can have much less patients, much fewer patients with secondary progressive MS. So that is the three main kinds: the relapse remitting MS, secondary progressive MS, and primary progressive MS.
So this is,
Before,
yeah. I said this is quite an insight, because earlier we used to think that RRMS, people suffering with RRMS, 50% of them, they get secondary progressive MS.
yes,
But now,
yes.
since we have more treatment options available, now the ratio has gone low. Probably
Yes, yes. This rate,
10%.
exactly, absolutely. This rate has reduced so much with the new treatments that were released in the last years, because we can, for example, identify the main risk factors, some features that the patients have, and show us the chance to have a bad prognosis,
Okay.
so that we can introduce effective drugs in a correct time that we call window opportunity window, the time that you can change the prognosis of the patient.
Prognosis. Okay. Okay. Doctor, I can see we are getting flooded with lots of questions. I think we should start taking questions one by one. The first question I can see popping up on my screen here is, I have by Isa, MS athlete. She has written, I have horrible stomach pains all the time. I go space, without eating. I go days without eating when it gets so bad. Can this be drug nutrient interaction? I eat very, I mean, she eats quite properly, seeing the nutrition. But
Yes, yes, I got it. If I got it, the question is about stomach pain in MS patients. That is a kind of, I would say, unspecific symptom that can be caused for a broad spectrum of etiologies. For example, if a patient has, for example, spinal cord lesions, the patient can has a kind of symptom that is this is called MS hug, multiple
yes,
sclerosis hug. That's a kind of a pressure sensation or a squeezing sensation of tightness
yes,
in your chest or
right,
even in your stomach area.
right,
And generally, that is caused by spinal cord lesions. That
right,
is one of the causes that can explain that symptom that is specifically from MS. But you have to remember that, for example, some medications that you use to treat MS, like for example, dimethyl fumarate, can cause some symptoms that is characterized by stomach pain or nausea or diarrhea. So we have to remember, I don't know if, for example, the patient is under this medication
I think
or if
Isa, if I'm not wrong, I think Isa is on Ocrevus.
ocrelizumab.
Pardon?
Ocrevus?
Ocrevus,
Have you
yes.
said that?
Yes.
Yeah, yeah. But regardless the medication, a patient with MS can have other disease, other comorbidities. I
Oh, I'm
mean,
sorry. She has written she's on Tizabri, not Ocrevus.
no problem. And regardless the medication, a patient can have a pain that is related to MS lesions or relate to other disease. For example, the previous disease that the patient has. Or, for example, the patient can have gastritis, or the patient can have, for example, side effects from other medication. It's important to
Right.
discuss with his neurologist about the symptom.
Okay. So Isa, you need to discuss with your neurologist, but Tizabri doesn't help. I mean, give you much kind of
In
pain.
general, Tysabri, that is natalizumab, that is a monoclonal antibody that
She
we
also
take.
has written that she has lots of oral medications such as Tegretol, gabapentin, and clonazepam. So maybe lots of medicines are creating her problem.
Yes, yes. We can have side effects from isolate medication or from a combination of medication. And regarding Tysabri, that is a monoclonal antibody that is used once a month. In general, we don't see that kind of side effects, stomach pain.
Okay, okay.
It's
So
important to discuss with the neurologist that is following the case.
thank you, doctor. We have another question from MS Jelly Legs, and she has written, if you are diagnosed later in life, so she's 46 years old, and how does does that affect the progression? So she has RRMS, and can her RRMS be dependent on her age to progress more?
Yeah, yeah, yeah. In fact, the age you start or you are diagnosed with MS can impact the phenotype you will have. For example, in progressive MS, the patient on average has a age that is more or less about 10 years older than patients that start with relapsing remitting MS. And about the prognosis, I mean, about the risk to develop disability if the patient has a disease duration that is long, or for example, if the patient has accumulated so much disability that is measured by a scale called EDSS scale. I mean, for example, if the EDSS is higher than 6, where you need to use a cane, in this situation, and specifically when the patient is older than 50 years old, in this conjunction, the prognosis is not the same as a patient that doesn't have these features. So younger patients with lower disease duration and without disability level, that patient, you can introduce drugs with more expectations to improve.
Okay. So, but right now, as per her, she's absolutely fine and she doesn't have any problem. She's just concerned about her age and RRMS. Will that progress with her age? Okay.
Yes.
Moving on to the next question. Shannon Wayne Hordis has written that she feels that she's getting Alzheimer's. Do you think that people with MS are prone to other diseases like Alzheimer's also?
Actually, patients with MS are not under more risk to develop other disease, other comorbidities. Okay. It's a quite more a quite higher risk to other autoimmune disease, but it's not, for example, similar to other neuroimmunological disease such as neuromyelitis optica spectrum disease. That is other kinds of disease that can mimic multiple sclerosis. The important thing about previous disease, about comorbidities, is that you should treat, for example, hypertension, diabetes, hypercholesterolemia, or you have to avoid to smoke, you have to maintain a normal weight to avoid obesity, because otherwise the prognosis will be worse than you had not had that. So I strongly advise to control the other disease that you have.
Okay. Okay, doctor. Thank you. Moving on to the other question that we have from Magli Toimeli. She has written, I have bowel and bladder ingot. My back has severe pain that is growing worse and seizing up with spasm. My legs and arms have severe spasticity.
Okay, okay. About this question is about some symptoms from MS. Yes. This kind of symptoms can come from, for example, relapse, or can be a result from an old relapse. So, for example, if you are experiencing a back pain or stiffness, I mean, when you cannot, for example, relax your muscle and you have a kind of spasticity, that was her question. Right. You can, first you have to determine if this symptom is secondary to MS, okay? Right. In the most case, it's secondary to spinal cord lesions.
Okay, okay.
If this symptom is, for example, is not a new symptom, is not, for example, a relapse, you will prioritize the symptomatic treatment. That is different from the preventive symptom that you can, for example, beta interferon, teriflunomide, or other kinds of treatment. The objective, the main, are totally different. So the symptomatic treatment of pain, of spasticity, is so important because that kind of symptoms will interfere the quality of life of the patient. Right. Regarding pain, first, the neurologist has to characterize the type of pain. For example, if it's a neuropathic pain, for example, if it's burning, if it's a shock kind of pain,
Yeah.
if it's pee and needles, because that kind of pain should be treated with a specific kind of medications.
Right.
Or, for example, if the pain is secondary, for example, to, for example, when you use a cane, or if you are on a wheelchair, you can need to adapt your position.
Yeah.
And because of this, you can have other kind of pain that are not directly related to MS. Right. And for example, physical therapies can, for example, advise the patient about that pain. And regarding spasticity, regarding stiffness, we have some kind of medications that you can prescribe, such as baclofen, or, for example, clonazepam, or tizanidine, or even in some case that you can answer in other question, CBD to treat stiffness.
Okay. So talking about CBD, what do you think about CBD as a treatment for MS?
Okay, it's such good question, because in general, the medicinal use of cannabis makes us like to have some discussion about the indication. Okay, let's explain what is cannabis in medicine. Cannabis is made up of many substances, okay? But you have two main substances that we identify in cannabis. The first one, I will tell you the abbreviations first. It's THC, okay? The second one is CBD.
Okay.
We have many other kinds of cannabinoids, but it's the two main ones.
Okay.
The THC, the tetrahydrocannabinol, is the substance that in general is used to recreational purposes. Is that substance that makes you feel high.
All right. Okay.
The second one, the CBD, cannabidiol, is used mainly for medicinal purposes.
Okay.
It's used for other disease, not only for MS. Can be used, for example, some cases of epilepsy, some patients with cancer. But regarding the use of CBD in MS patients, you use for pain and spasticity.
Yes.
But that has to be prescribed by your neurologist, and in general, in very specific situations.
So how do we know that we need CBD oil or CBD cream to treat us? How do we know that we need that?
Yes. For example, if you have a kind of pain that does not respond to conventional treatment, or you have, for example, stiffness, muscle spasticity that doesn't respond to, for example, a combination of 3 drugs, we can, for example, prescribe and indicate CBD for this case. But it's important to know, it's so relevant to emphasize that not everyone will respond to CBD for example, these two situations.
Okay. So
it's important to discuss.
It's
important to discuss with your neurologist the situation that you have to know that is indicated or not.
Yeah, because there's a lot of promotion of CBD oils and CBD creams and pain management with CBD. But yes, we have to go to a neurologist, ask them if we need it, then only we should take.
Yes,
That's something to be
yeah,
noted
because
about. Yeah.
because in general, as I said, MS patient is varies from patient to patient, and the
Yes.
symptoms will vary as well. And for example, if for example we know a patient that has responded to CBD,
Right.
uh, that's not mean that you will respond, because
Hmm.
each body responds in a different way.
Yes, yes, yes. So this is something which is very important to be noted. So we see lots of ads for oils and creams. I think self-medication is something we should not do. Should always
Yeah,
consider neurologist.
yeah,
Moving
definitely.
into the other question, doctor, Desi has written, what medication do you recommend? Also, what do you recommend for pain or memory loss?
Pain and memory
And
loss.
memory loss, yes.
Okay, okay. As I said in the other question, for pain, will depend on the kind of pain you are experiencing. So, for example, if you are experiencing a kind of neuropathic pain, I mean, for example, a sensation of burning, of shocking, of pins and needles, and is restricted to, for example, your arm, your leg, or some area of your body, we can prescribe uh, some kinds of medications, for gabapentin, pregabalin, lamotrigine, and other kinds of medications. Discuss with your doctor the more suitable drug that will fit you. And regarding to memory loss, it's so important to remember that cognition is a aspect, a symptom that the patient will complain. For example, many patients will complain about, for example, difficulty in paying attention, poor concentration, memory loss, or,
Yeah.
for example, difficulty in decision making.
Yeah. Confused thoughts. Yeah.
Yes, because that can be explained for different reasons. For example, if you have an amount of lesions that can, for example, disconnect your network. For
Right.
example, your network that you have in your brain that makes you think in a normal way, or for example, that makes you able to memorize some facts,
Mm.
and that lesions can disconnect
Right. Right.
some areas. And in
Yeah.
other case, you
Yes.
can have lesions inside the cerebral cortex, that is the more peripheral area in your brain, that
Okay.
is not well seen on conventional brain MRI, only
Okay.
in higher magnetic size, or even in specific MRI sequence. But that is a specific
Oh, topic. Okay.
situation.
Okay.
But regarding the treatment of
Yes.
cognitive disturbs in general, first you have to know the pattern of your difficulty, because it can be, for example, secondary to fatigue, can be, for example, secondary to mood disorder like depression, like anxiety. So first of all, you have to know the cause or the factors that that can affect your cognition. So
Yeah.
treat depression, treat anxiety, do exercise, and we have to see, for example, if the medicine you are
Right.
taking can affect your cognition, because some drugs to treat, for example, neuropathic pain can affect cognition. And after that, we can relate and isolate that symptom that is from MS.
Right.
And unfortunately, we don't have a kind of medication that can help memory. For example, if I take this kind of medication, I will improve my memory. No, it's not a truth. We have some kind of medication that we can try to stimulate attention, to stimulate, for example, your level of, for example, you are paying more attention. But not all everyone will respond.
Right. So good diet and probably normal exercises can something which can help in cognitive dysfunction.
Yes. In general, that kind of situations about fatigue or can influence, and doing exercise can help in an indirect way.
Okay. Do we also have some kind of memory games or something which help people in this kind of conditions?
Okay, that is related to cognitive rehabilitation. It's like to stimulate you to memorize some facts. In general, I don't see any problems to recommend, to advise that, because it doesn't side effects, adverse events. But what I have to emphasize you is that we don't have yet
any medication
enough evidence to prescribe a kind of cognitive program of rehabilitation.
Okay, doctor. So moving on to next question. Okay, Manvi Hiran has written, can you please suggest me a good doctor in India? Manvi Hiran, can you please DM me separately? I'll help you out with that. Okay, I have got another question from Magni Tomeli. She has got COVID-19 and her immune system is terrible, along with MS. So she's a little scared. So what do you have to say for this, doctor? Since I saw the news, in fact, I saw around 50,000 cases in Brazil of virus yesterday. It's quite a scary situation.
Yes, actually, the outbreak here in Brazil is doing in a bad way. But talking about the COVID-19 disease in MS patients, that is, how can I say, is a challenging topic. But we know more today than, for example, January, February, March, in the beginning of the outbreak. So what do you recommend? What can we say? First of all, MS is not a risk factor to develop severe forms of COVID-19 disease. Okay.
Okay. So there were some studies which said not the MS but the DMTs, the medicines.
Yes. Is that what I was talking? But MS is not a risk factor, but the real doubt is about the drugs, because the drugs that you are taking are immunosuppressive in the most cases. And what we know is that the most drugs in general are drugs with a low or moderate risk to develop severe forms of COVID-19. Fortunately, Italian study that was published in April showed some good news about MS and COVID-19.
Okay.
Yes, about 96% from 232 patients had mild cases of COVID-19 disease. I mean, most patients had not severe forms of COVID-19 disease. So it's important to discuss with your neurologist your profile. For example, will depend, for example, on your age. If, for example, you are 20 years old, or if you are, for example, at 60 years old, will be different. If you, for example, have comorbidities, will be different. and will depend on the drug you are taking. And regardless the recommendation, what we strongly recommend is the same to the general population. To try to maintain a social distance, to wear mask, to wash your hands, is the general recommendations that we maintain for all our patients.
Of course. But doctor, what if someone has MS and suddenly gets COVID-19 also? And I know that people do not want to go to hospital and get admitted. They all are scared. What other any kind of medicines a person can take, or they should directly go to a neurologist? What do you suggest?
Yes, people with MS that has been affected for COVID-19 disease can be treated in the same way. For example, if the patient needs to undergo, for example, chest CT, has to undergo. If the patient, for example, needs to be admitted in an ICU, it will be on the same way. The main doubt is about to stop or not the medication.
Yes.
Okay. In general, we don't advise to stop the medication, most of them. Okay. But it's so important to discuss with your neurologist if your drug that you are taking is or not compatible with COVID-19 on the acute phase disease.
Okay. Okay, thank you, doctor. Moving on to the next question, I have a question from Tag 18, and she has written, what's your opinion on stem cells therapy?
Okay. It's a common question among patients I have. First of all, I think that we have to clarify what is stem cell therapy. Okay. Yes. So, for example, stem cell therapy, you can use, for example, embryonic stem cells that has a potential to differentiate or to transform in specialized kind of cells like neurons, and can be used, for example, in progressive phenotypes where the patients have lost for example, the neurons.
Okay.
That kind of stem cell can be used, for example, from embryonic cells, from mesenchymal cells. You will depend on the kind of cell you use. And many studies have been done about about stem cell therapy, but we still need more efficacy, safety, and methodology evidence about that before to apply as a conventional therapy. It's a promising therapy in the future, but at this present we cannot recommend like in a broad way. And we have other kind of stem cell therapy that's called hematopoietic stem cell transplantation, where you do a kind of induction therapy to reset your immune system. It's a kind of chemotherapy that you use so that you can reset your immune system and you can drop your inflammation level and prevent disability in the future.
Okay. There has been quite a lot of debates when it comes to stem cell therapy. So, for example, it was like years back when I'd gone to US and I asked the doctor for stem cell therapy, and the answer given to me was like, it's all fraud, should not go again with it.
Yes,
and then on the other hand, now we see People like
Yes.
Selma Blair, the celebrity Selma Blair, she got diagnosed with MS and her condition was bad, and she went for stem cells therapy, and she's doing little better than before now. So, like you said, it can be a promising treatment in the future.
Yes, absolutely. It's a promising kind of therapy. We cannot we cannot say like a general kind of treatment to
Right.
prescribe like everywhere for everyone
Of course.
yet. But it's a promising kind of therapy, not only in MS, but in other disease. For example, patients that have disability after trauma or after a stroke or after some kinds of disease that you have more degeneration. Yes, it's a promised therapy.
Okay. Moving on to the next question, doctor. We have a question from Wrestle News, and he's written, Doctor, is migraine associated with MS? What do you think? Is
I have
migraine...
cut. Sorry, I have cut. Can you
Yeah.
rephrase?
Yeah, is migraine headaches associated with MS?
Okay. Yes, that's an interesting question because migraine is much more common in MS patients than in the general population. Yes. Some studies have shown that between 2 to 3 times, that migraine is between 2 to 3 times more common in MS
Okay.
than in patients that have not MS.
Oh, okay.
And it's important for many reasons, but I will mention 2 reasons. The first thing is that some kind of symptoms that follow a migraine crisis can be followed, for example, with vision and symptoms, or for example, visions in your sensation, like for example, you can feel numbness
Right.
in one side of your
One side
body.
of the brain. Yes,
Yeah,
yes.
or you can, for example, feel temporary vision loss of one eye.
Yeah.
And it's important to differentiate regarding to the quality of the symptoms and the duration to differentiate, for example, from relapse. And the second thing is about patients, MS patients who has lesions inside the brainstem,
Yes.
an area that is located inside your neck. That patient is more prone to present migraine. It's important to discuss with your doctor because we have measures, we have recommendations to treat migraine in MS patients. We have recommendations that are medicine and recommendations that are not medicine. For example, have a good sleep, do exercise, have a healthy and balanced diet.
Right.
And besides that, we have some kinds of medication that can prevent and reduce the frequency of migraine crises during a month, for example.
Okay. So if I have to tell you about myself, I have MS since last 8 years now, but I got migraine, I think, 2 years back. First 6 years was like normal for me, but 2 years back I started getting this migraine headaches. Yes, doctor did prescribe me medicine, but I avoid that. I usually do.
Yes,
I
we'll
control it with sleep.
yes.
I just take off from my office and sleep for 2-3 days. That's fine for me. That's
No,
taking more medicines.
yes, absolutely. You have to discuss with your neurologist about, for example, the risk-benefit profile of prescribing some kind of medication to prevent migraine. And before prescribing that, you have to be aware if you are following other recommendations about diet, exercise, your sleep, avoid stress, your routine.
Yes. Moving on to the next question, doctor, we have a question from Desi. She has written, what do you recommend for pain in body? What do you think about memory loss early stage? Uh, she is on Ocrevus and thinking about coming off due in low risk of cancer. And what medications do you otherwise recommend?
Okay. I think that I said that in the other question about
Yes.
pain and memory
Pain.
loss.
Yes.
Yes, it's so I will emphasize that information is about to make sure about the type of pain you have to discuss with your neurologist, because if it's, for example, that kind of pain that I have said, neuropathic pain, burning, pins and needles, shocking, you can have some kind of drugs. And regarding memory loss, is a biomarker of prognosis when those symptoms start since from the beginning. So
Right.
it's important to start with some kind of medication if it's a relapsing remitting MS or is a active form of progressive MS. And but if I understood the patient is under treatment, it's important to maintain the treatment and discuss with their neurologist about other measures like to stimulate cognition, even though we don't have so many so much evidence in this field.
Right. Okay, doctor, thank you. Moving on to the next question. Okay, now lots of people, nowadays we are seeing they want to go off the medicines. They don't want to take any medicines, and they want to live a healthy lifestyle, eating, having nutrients and good exercise, good diet, and control their MS naturally, and
Yes.
not be on any kind of DMT. So,
Yes.
so talking about this question, Fabif Mash has written that, is there any kind of chances to stop the treatment since she did not have relapse for a very long time?
Yes. Yes. No, I got it. Um, it's important to know that we have to prevent disability in the future. Okay. And we have ways to prevent it. Besides the medication, we advise, for example, beta interferon, terflunomide, dimethylfumarate, tocorizumab, whatever. We strongly advise healthy and balanced diet and do exercise. But this change in lifestyle doesn't replace the conventional treatment.
Right.
Both are complementary.
Okay.
So what I recommend is to discuss with your neurologist, because depending on your level of disease activity, you can need the drug besides to have a good lifestyle. It's important because some patients can only follow diet, some patients can only follow, for example, try to maintain normal levels of vitamin D. Some patients can try only to do exercise, but all the measures are complementary and are on a specific way.
Okay, because I see that lots of people who are associated with me on this group, so there are people who are not taking any kind of DMT, but they are doing regular exercises and they are taking nutrient supplements, and that's what they are having, and they are managing their MS, and they seem quite happy. But like you said, MS differs from person to person as well.
Yeah.
So,
Yeah.
but
What we recommend regarding diet is to maintain a balanced diet.
Right.
We don't, for example, advise some diets that exclude some kind of components of foods. For example, paleo diet, keto diet, because you will, in general, we advise diet with, for example, good carbohydrates, good proteins, good fats, good vitamins or minerals. Have to be balanced. If you, for example, are in doubt, talk to your neurologist, talk to your, for example, if you have dietitian about the best diet will fit you. But in general, there is not a specific type of diet for
Okay.
MS patients. It's important to emphasize that.
It's a very quick.
It's important to maintain a healthy and balanced diet. Okay,
It's a,
we don't advise, for example, for everyone to, for example, to do a restriction of gluten or to do a restriction of lactose. That will depend from patient to patient.
okay. Yeah, because this is a very good point, and this is the most debated topic. People
Yeah.
say that legumes cause you more fatigue. Many people don't have eggs. People have stopped taking dairy products, and there's so many facts about new kind of diets as well, like keto diet and paleo diet. And there's sort of confusion when it comes to MS diet. But on the other hand, we also have patients who eat everything on earth. So, like you
Yes.
said, it differs from person to person.
Yes. Yes. That's
Doctor,
it.
one
Absolutely.
question from
Very so much.
Doctor is one question from Isa.ms athlete, and she has written that oral medication drugs, can they cause any kind of nutrient problems?
Sorry, can you rephrase?
Oral medication drugs, can they cause any kind of nutrient problems?
Okay, okay. If you are taking some medication that can, for example, influence in the absorption of such kinds of nutrients, you have to avoid it. We have some kind of medications that, for example, can protect you from one symptom that can, but that can influence on absorption. Or even you can have other disease that can influence, for example, in absorption of B12 vitamin, and
Right.
it's important to make sure if you need or not such kinds of supplements.
Okay, doctor, thank you. The other question by Evie Tisnia is that, doctor, you know if gelenia causes stomach pain problems?
Okay.
So, doctor, before we start answering, there's a cap of 1 hour on Instagram. So,
Okay.
in 1 minute, this call might get disconnected, but we can join back again in the same way.
Okay. Okay.
Yeah. Yeah. So we can tell about gelenia if it causes stomach problem.
Okay. Gilenya is a kind of drug that is used for MS. It's a commercial name. Actually, we call fingolimod, and sometimes can present some kind of side effects like headache, fatigue, or even other side effects on your blood test or on your eye. Pain is not a kind of symptom that is typical from fingolimod. You have to make sure if it's secondary, for example, your own MS or not, discussing with your neurologist. For example, It's much more common to have pain after beta interferon.
Okay, doctor. Doctor, and the question I have, which is very interesting, and this is my question too. Taking Avenex always causes flu-like symptoms. Is there a way to avoid this?
Okay. Sorry, can you rephrase?
So Avenex always causes flu-like symptoms.
Okay.
Fever.
Flu-like symptoms. Okay.
Yeah.
regarding beta interferon, that was one of the first approved drugs to treat MS, because the first one was betaferon.
Yes.
Yes, but regardless the kind, if it's betaferon or it's Avonex or if it's Rebif or if it's, for example, Plegridy, that you can have depending on the country you live, both can present some kinds of side effects. Okay.
Yes.
And for example, you can feel after the injection as if you had flu. I mean, for example, you can feel fever, chills, headache,
I'm on
muscle
Tablet since
pain.
last 8 years, and it's horrible for me.
Yeah,
I get flu and pain and uneasiness.
yeah,
It's horrible.
yeah. In general, that can occur at least in 10% of patients. Okay?
10% only.
Yes, at
Okay.
least. At least. I mean, 1 in 10 patients can
Okay.
present this kind of symptom.
Hmm?
So we in general advise some measures to avoid that. Okay? For example, we advise, for example, to take it out the fridge 30 minutes before the injection.
Okay.
We advise to try to do the injection before going to bed. And you can take, for example, ibuprofen or paracetamol before the injection.
Oh, okay.
If
Before the injection.
Yes, if
Okay.
you are taking all these recommendations, and these side effects have not improved, and your MS disease is under stability, you can discuss to your neurologist about other options to
Okay.
switch, to change, okay? Because today we have more than 10 options to treat.
Yes.
And besides the flu symptoms, we can have skin reactions. For
Oh,
example, yes, you can feel, for example, your skin becoming red, or for example, bruised or itchy where you have injected.
oh, yes. So I can say this is a very good point. I've been taking the last 8 years, and I always get flu. I take paracetamol. I do all that, but taking the injections 30 minutes before, taking the injections is something which is really good.
I know. But we have recommendations to avoid, because otherwise you have a limitation in your life quality. So it's important to talk to your neurologist, because we have other options.
Right. We have other option, but if you are on any kind of medication.
Yes. But at the same time, I have patients under beta interferon that are well,
Oh,
that don't complain from flu symptoms, or don't complain, for example, about skin reactions. Okay, this information don't work for everyone. Will depend, as
from
everything
person to
will
person.
depend from patient to patient.
Patient to patient. Yes, absolutely. So it differs from patient to patient, the kind of reaction you're getting on your body of the medicine. But I have to repeat this once again, that if you're taking injection, take out the injection 30 minutes prior from the fridge
Yes,
for
yes,
taking it,
yes,
so
yes,
that
absolutely.
you don't get fever the way you usually
Yes,
do.
yes.
I am
Is
gonna also
one,
follow this.
yes, that is one of the measures. Take it out the fridge more or less 30 minutes before the injection.
Right. Yes, thank you, doctor. Moving on to the next question. Eminel Jezik Mac, I'm sorry, I'm not able to pronounce properly. He has
No
written,
problem.
in Fingo Limode, do we get acne very much and a little red scars? or acne?
Okay. In general, fingolimod present some kind of side effects. Okay. The main ones are fatigue, headache, some kind of vision react, not really, not visual reaction, but you can have, for example, edema inside your eyeball, or you can present skin alteration, skin changes that have to be followed by a dermatologist. We advise once a year, okay, because there is a risk that is higher on fingolimod patients to develop skin cancer. That there is not a high risk, okay, but this risk is higher when we compare to patients that are not taking fingolimod.
Oh, okay. So, but you say that acne, scars, and all is something which
in general is not such a common side effect from fingolimod. For example, it's much more common on patients that are using steroids, that are using general after relapse.
After relapse, yeah. No, I get that. It's horrible.
Yeah.
But I suggest you should concern your neurologist if you're getting scars with fingolimod. Moving on to the next question, doctor. This is in Portuguese, so I can't understand. I'm sorry. I have to move on to the next question by Naida Berna. She has written, how long would you wait to switch DMT? If you have to change your medicine, how long should you wait? Her first scans post-diagnosis came with 3 new spots. And doctor is now advising to switch from Tecfidera to infused therapy. 8 months of Tecfidera, now 13 months. And she has RLS.
Okay. To prevent disability in the future, we strongly advise to undergo regular MRI at least once a year, okay? If we detect new lesions on brain MRI, we can, for example, anticipate the moment you, for example, can present new relapse or clinical progression. For example, in that case that she presents 3 new lesions, this number, 3 lesions or more, in many studies are a biomarker to develop new relapse or to accumulate disability in the future. So that we advise switch from one drug to one more effective drug. That is the case of this patient, if I have understood.
Yes, so her doctor is asking her to change the medicine.
Yes.
Care for that, if changing is the right decision.
Yes, and about switching, about change the drug is not only when you have drug failure. As we are saying about side effects from beta interferon, it's a kind of situation that you can change as well, but not because drug failure. It's because side effects.
Yes, so there are no risk involved since the neurologist.
Yes. But I think that the recommendation that her neurologist has advised her, it's good, it's okay, because 3 new lesions in general, depending on the moment you have undergone your brain MRI, is a number that we concern about. And it's important to know that the number of new lesions will depend if the drug had enough time to act in your body.
Okay.
Because, for example, beta interferon in general can last about 6 months to start their actual action mechanism. Or, for example, natalizumab or ocrelizumab both have a quick action starting. So
Okay.
will depend on the kind of drug you are taking.
Okay, doctor. Thank you. So neither you should be satisfied that doctor is giving you good advice. So moving on to next question popping on the screen is what are black holes and how are they related to the prognosis?
Okay, okay. Black holes are a specific kind of lesions that you see on brain MRI scan.
Hmm.
On brain MRI scan, we have different kinds of sequence, okay, with different kinds of signals, of different kinds of colors, okay.
Okay.
We have a specific kind of sequence that we call T1, okay.
Okay.
If you have some lesions that appear like black on this kind of sequence,
Okay.
and that lesion is old,
Okay.
you will compare. It's because I would have to say some technical terms. You have to see other sequence
Okay.
because we can have false black holes, pseudo black
Pseudo.
hole.
Yes.
But
Yes.
saying about the true black holes is a kind of a tissue that was more destroyed.
Okay.
That means that in that area, you have lost the neurons.
Okay.
It's not only demyelination.
But the neurons have been lost.
Besides demyelination, you have degeneration.
Degeneration.
And
Yes.
this is a biomarker of bad prognosis. But not everyone that presents black holes in the beginning will present a bad prognosis. It depends on the volume of black holes. That will depend on the amount of black holes you present.
But is this a common thing, doctor? Black holes?
If it's common,
Is it
yes,
common to have?
yes, it's quite common.
And
In
what
general, we
kind of
see.
MS can we find that?
Actually, we cannot, for example, recover the black holes. In general, the black holes don't present a kind of potential to recover.
Yes. So
For
this can be
example,
mostly found in the secondary progressive MS, is it?
it's much more that can be appear in any kind of phenotype. Okay, in
Okay.
relapse remitting disease, in secondary progressive disease, in primary progressive disease, but it's more common to have more volume of black holes or a number of black holes that is much higher in
Right.
progressive phenotypes.
Right. We have another question from Scorpio, and I was also getting into it. Can black holes heal either from DMTs or any kind of alternatives, natural alternatives?
No, we don't have yet any kind of treatment that can reverse the black holes to the natural way. What we do with the drugs is to prevent new lesions or lesions that can, for example, accumulate over the time.
Okay, doctor. Thank you. And moving on to next question, doctor, by Tammy Way 65. She has written, does swelling problem is a part of MS? Like people with MS, do they have swelling in their body somewhere? Is it very common for MS patient to have?
Depending on the phase you are experiencing, can be common. For example, in some case, for example, that you have, for example, lesions in your brainstem is more common. Or, for example, according to the duration of the disease duration, as much longer as your disease, more probably is you have a swelling problem.
Okay. And what about swallowing things? So if you have to eating, you're not able to eat properly. Is this also a part of MS? And can
Yes,
it be
yes,
cured?
yes. In general, are related to lesions on brainstem or the top of the spinal cord. And yeah, we recommend some kind of therapy
Okay.
with, yes, with professionals that are specialized in rehabilitation in this kind.
Doctor, we have another question. I think you will be able to read it more than me.
Yes, it's in Spanish. It's about memory loss.
Okay.
What should I do to avoid in the future? Okay. As I said, it's a marker of bad prognosis in the future if you present memory
Okay.
loss in the beginning, but
Okay.
not any kind of memory loss. Okay. In general, more than 50% of patients will complain of that. But we don't have yet specific treatments to improve memory loss. As I said, what we recommend is to treat first fatigue, to treat first, for example, mood disorders like depression, anxiety,
Right.
sleep well, eat in a healthy and balanced way, do exercise. And in some cases, we can prescribe medications to improve your attention, but only in specific case.
Right. Moving on to the next question, doctor, we have another question about diet again. So what's your opinion about the plant-based diet in MS? Do you recommend
Yes.
leave the meat in your patients?
Yes, regarding this question, I have an opinion that not only for MS patients, for everyone, you have to try to have a healthy diet. And I believe that a plant-based diet with a low amount of meat or without meat is
Right.
healthier to patients because meat can increase your risk not only for inflammatory landscape, but for example, increase your risk to heart disease, to cancer disease. And if we consider that eating more meat can have more inflammatory potential,
Right.
that is not devised for MS patients. So in general, I particularly strongly advise to avoid that kind of food. Not exclude at
Okay.
all,
But reduce.
but
Yeah.
to avoid, and one more time, to have a balanced
And
diet.
what about fish, doctor? Since it has omega, and we know that it is good for the brain cells. What about fish?
Okay. One more time to emphasize, we don't have a kind of MS diet
Yeah.
to recommend for MS patients. Okay.
Yes.
What we recommend is, for example, regarding fish, we don't have scientific evidence
Okay.
to, for example, to tell my patients that eat more fish or not. Okay.
Oh, okay.
What I recommend is to avoid some kind of foods, for example, like meat or like sodium, for example, saline, because that can, for example, put you in a higher risk to other diseases like heart disease, like cancer or other disease, and that comorbidities can worsen your MS. And
Yeah.
besides that, if you think in a biological plausibility way,
Hmm.
that kind of foods are more inflammatory. And we know that probably a
Right.
plant-based diet or fish or other kind of food have a lower inflammatory potential compared to meat, for example.
Hmm. Okay. Right. So there's no particular kind of MS diet. you have
No,
to
no,
have
no.
everything back to you. Right.
We cannot say that, and we cannot, for example, advise diets based on restriction, like keto
Right.
diet, paleo diet, where you exclude some kinds of foods.
Right.
Otherwise, you can need, for example, some extra supplements.
Right. Doctor, I have a question from Scorpio again. She has written, I have RMS and I have joint pains in my knuckles. Is that a part of MS? It mostly bothers me when I wake up in the morning.
Okay, okay. That would be a specific task that the patient has done. I think that regardless the symptoms or the routine, the patient has to be aware about what is more suitable for
Okay.
him, right?
Yes.
Regarding memory, regarding fatigue, uh, concerning, for example, pain, whatever. These specific situations
Yeah.
that work for one person has to be considered for the
Yeah.
doctor, but cannot be generalized for everyone.
Right.
I don't know
Okay.
if I explain well.
No, so she has pains in her joints and her knuckles. So that's what she was. But I understand from you that it is not very specific, and probably she has to consult a neurologist that why she's having those kinds of pains. This because it is not a general common symptom that people
Yeah.
have joint pains. Moving on to the next question, Evie has written that are there any kind of good vitamins like vitamin D or any supplements that you can recommend?
Okay. We don't recommend any kind of extra supplement to everyone.
Okay.
What we know is that MS is a multiple factor disease. I mean, MS has many risk factors, okay?
Right. Right.
We know that genetic and environmental factors can interact each other
Right.
and can increase the risk to develop MS.
Yeah.
Among the environmental factors, we have low vitamin D.
Right.
Okay.
Absolutely. Yeah.
Besides that, we have, for example, obesity, tobacco exposure. We have some kind of viral infections, such as mononucleosis. But talking about vitamin D, what we know is try to maintain normal levels of vitamin D. We don't recommend like mega doses or extra doses to maintain very high levels of vitamin D on your blood tests, and because otherwise you can have a higher risk to develop, for example, kidney dysfunction or very high calcium levels on your
Right.
blood tests. What we know is that if you have low vitamin D's at birth
Mm.
or throughout the childhood, you
Yeah.
can be at a higher risk to develop MS.
Okay.
Okay. And if you are in the beginning of the disease, I mean, in the early stage of the disease, at this moment,
Mm.
it's much more important to maintain normal levels of vitamin D. It's not the same if you have a diagnosis that year, this year, or for
Right.
example, if you was diagnosed 20 years ago.
Yeah.
The recommendation about maintaining normal or super normal levels of vitamin D is basically more to early stages of MS. In
Mm.
general, we supplement when the level is low.
Very low. Yes. Yes.
Okay, it's very low. That
Okay.
that is truth. We recommend in that case.
Doctor, talking about vitamin D, people, there was a debate earlier. People were saying that people with low vitamin D are at greater risk of having multiple sclerosis. But nowadays, it's like because of the lifestyle change in people without MS also has low levels of vitamin D nowadays. So,
Yes, yes. It's so common because
yeah,
to have a normal level of vitamin D, we have to have sunlight exposure. You have to eat enough food with the pressure of vitamin D, and in general, people don't do that.
yeah.
So yes, so most people will have low vitamin D levels, not only MS patients.
Okay. We have another question popping on my screen by Niharika Goswami. She has written that no, not sure if I have MS, but I often experience numbness and body pain. How do I know if it is MS?
Okay, okay. Um, it's important to talk about the diagnose, the correct diagnose, because not every symptom about vision or sensation or motor symptom in a young woman will be MS.
Right,
Okay, so you have to make sure to your neurologist if your symptoms are specific for MS.
right.
If, for example, you have indication to undergo a brain or spinal cord MRI,
MRI, yes.
or even though you have done that, if you have specific lesions that fulfill the diagnosis criteria of MS. Because in some cases, you can have misdiagnosed.
Right,
I mean,
which is very
incorrect
common.
diagnosis.
Yes,
Yes. And according to some studies, between 5 to 10% of MS patients can have misdiagnosed.
yes.
And
That's very
that can,
striking, yeah.
and that can, for example, expose the patient to some consequence, like, for example, to be treated with some medications for years, consequence for their families, for neurologists, for the healthcare system. And we have some situations that can mimic MS.
Right,
For instance, you have migraine, you have fibromyalgia, you
yeah,
have functional disorders like psychiatric disorders, you
yes,
have small vessel cerebrovascular disease,
right,
because or the patient will complain about unspecific symptoms,
right.
or the MRI can show us some kind of lesions that can or mimic or can be just unspecific.
Hmm.
And some doctors can, for example, inform the patient about a MS diagnosis. It's important to make sure the
Yeah,
symptoms have to be specific,
yes,
the image has to be specific,
right.
and I'd like to emphasize that MS diagnosis should be done only after no better explanation than MS you find.
Yeah, so it's like the same kind of symptoms you can find in many things. You can have in migraine, you can have in fibromyalgia and other diseases also. So just
Yes,
by knowing the symptoms, it cannot be said that yes, if you have numbness, you have MS. It's not like that. You have to actually
yes,
go undergo through many clinical trials to understand and to establish the fact that you have MS. Like you have to go through MRI scans and find the lesions or the spinal tap test or things like that, but as prescribed by a neurologist. Moving on to the next question, doctor. It is again in Spanish, I guess.
it's in Spanish. Now I
Yeah.
can read for you.
Yes.
It's if the patient can worsen their memory disturbs, the memory problems. Okay, yes. if depending on the phenotype, for example, if you accumulate new lesions or new relapse
Yeah.
over the time, you can, for example, affect some areas that are important to cognition, attention, visual spatial perception, memory, whatever. And if it's a progressive phenotype, you can worsen slowly, and
Right.
you cannot realize the exact moment you have lost your memory. So yes, a memory loss can be related to accumulation of new lesions
Right.
or a slow progression of the disease.
Okay, doctor. Um, Doctor, moving on to the next question. It's by LJ1186, and he has written that can we take probiotics and vitamin C with MS?
Yes, yes. As I said, we don't recommend in general extra supplements of minerals or other kinds of vitamins for everyone. If you have a balanced diet, a health diet with the main components, you will eat all the components. So only if you have a low level of vitamin D that we recommend to take it, but
Yeah.
not vitamin C or vitamin E, because we don't have scientific evidence to prescribe to everyone.
Hmm.
Okay, the thing that you have to make sure is that are some kind of supplements that have side effects.
Yes,
Yes.
we have. Okay. But like they're saying, during coronavirus time, people are taking loads of vitamin C nowadays.
Yeah, that's it. Yes. And for example, when the media publish, for example, about chloroquine or steroids or vitamin D, people start to go to the pharmacy and start to take some medicine, and that is not advisable.
Okay.
Talk to your doctor before to taking any kind of medication.
Okay, doctor. Thank you. Doctor, there's another question by Cregan1234. She has written, what's the best treatment for severe spasticity in your legs?
Okay. There's no a kind of best treatment, okay? That has to be individualized, okay? Your neurologist should characterize your pattern of spasticity, the
Okay.
side effects that the medications can have to you. But for example, baclofen, tizanidine, or for example, some medication like clonazepam can be used. And if you don't improve with conventional treatment, we can use, for example, CBD, as I said, cannabidiol,
Hmm.
or even you can use, for example, baclofen inside your spinal cord, okay? Or even you can apply botulinum toxin to relieve the symptoms.
Okay.
But that will depend on the degree or the level of specificity.
But physiotherapy can also be something which can help in spasticity, right?
Yes, that's right. Absolutely.
Exercise and physiotherapy always goes hand in hand.
Yeah, no, physical therapy, it's so important. It's a complementary measure that we always advise. Besides doing exercise, physical therapy, and the medication. Yes, because stiffness of your muscle will respond not only medication but some physical measures.
Okay. Doctor, I can see you. We are flooded with questions, and you've been tied up with almost 2 hours now. Would you like to continue answering, or are you tired already?
No, I'm not tired. It's only because I have some compromise.
Oh, I'm sorry. Is it, what time is there?
Here is 2:37.
I hope you're done with your lunch then.
Yeah, yes. It's about the lunchtime here in Brazil. Maybe, yes.
Okay, we'll try to finish it as soon as possible. Okay,
Yes.
continuing with the next question. Pity Owl has written a very interesting thing. She has written that I heard that some doctors were testing patients with metformin, which is a diabetes medicine, and supposedly it is helping with myelin sheath. Is it true?
Okay. Metformin is a oral medicine that is prescribed by for diabetes type 2. Okay, can be prescribed in other situations. For example, some people with some metabolic syndromes. But nowadays, we don't have scientific evidence to prescribe this kind of medication for MS patients.
Oh, okay. We do not have. Okay, thank you. Moving on to the next question. Okay, we spoke about vitamin C and the other supplements. I guess your answer remains the same for this. Is biotin good for MS? Biotin.
Okay, yes, biotin. Biotin is a kind of vitamin, actually B7, that was used in some clinical trials, some big clinical trials in Europe, to like complementary treatment, mainly in progressive MS, but not only progressive MS, in relapse remitting MS, but in very high dose. Okay, it's not conventional dose of biotin, but
So
the
on
evidence
average, how much do you think a person should take per day with MS?
is more than 500 milligrams.
Okay.
But I can make sure about the dose. I don't remember actually, but it's a high dose. But regardless, these clinical trials, we cannot yet prescribe it to everyone.
Okay. Doctor, we have another question from Hudson. He's written, is all MS progressive by definition? Do we progress? Yeah.
Okay. When we are talking about the name progression or progressive, we are talking a slowly worsening of symptoms. Okay. Any patient can present that, but we as neurologists classify the phenotype of relapse remitting, or for example, primary progressive or secondary progressive. Okay.
Right.
But the mechanism behind progression, that is neurodegeneration, can happen in everyone. So that is why that patient has asked me about is progression like common in every patient or occur in every patient. Can be or not, because you will have one phenotype that is more frequent, or inflammation in relapse remitting MS, or degeneration in progressive MS. But both can occur, can overlap in the same patient.
Oh,
okay.
So it can. Okay. Doctor, another question popping on screen is, do we get hair fall with MS? If yes, what medication should be taken? I think this is my question too. I have lots of hair fall. It's quite embarrassing. And I noticed that after my last relapse and I took steroids, after that, I think I have significant hair loss.
Yes.
Continuing since then.
Yes. Actually, MS itself is not a cause of hair fall, okay? But you have some medications that can affect hair fall. For example, with steroids, when you have a relapse and you need steroid treatment, okay?
Right. Right.
And you have some kind of medication. The first one that is more related, is the most one, is teriflunomide, is related to hair fall in about 30% of patients, but in
Okay.
general, that can improve after 6 months in that patients, okay? In
Okay.
some other patients, dimethyl fumarate can be factors that can affect hair fall as well.
Okay.
In some patients, cladribine can affect as well. We depend on the medication and
I
it's
mean on Alex,
individual.
for example. Does Alex
Yes.
also give
In
that?
general, we don't consider that is the main pattern of the side effects from beta interferon, but can occur if you look at the big list of side effects each medication has.
Yeah.
Yes, we will look at many side effects.
Oh, that's just too much.
Yes, yes.
Okay. Pithy Owl has a question. She has written, "What about skin issues? She takes Capaxone, and she has lots of skin issues with that. What can we do to alleviate this?"
Can issues?
Skin issues. She has skin issues, and she's on
Uh,
Copaxone.
okay, skin reaction. Okay, no problem. I got it. Sorry. Copaxone, that's glatiramer, is a kind of medication that was approved like 20 years ago,
Right.
and nowadays you use 3 times a week, like for example Monday, Wednesday, and Friday,
Okay.
is in your skin subcutaneous, and you can present skin reactions, like you can have the area that you have injected can be, for example, red or itchy. And what we recommend is, if those reactions are persistent, even after some recommendations, we can switch to, for example, an oral drug.
Okay. Okay. So maybe she should consult a neurologist and get it
Yes,
checked that why
but
she haven't. Yeah.
but not to everyone, okay? Because, for example, I have many patients under Copaxone that are doing well, and I have other patients that, for example, had skin reactions only in the beginning of the treatment, and
Right.
after some months, these patients have improved and are doing well.
Okay. Doctor, another question we have from Zohail, and she has written that, "Does anyone suffer with super red in the cheeks and ears, and they're super hot?" So yeah, this kind of thing, I've heard from many. Sometimes the hands get very burning like sensation. So for my example, my feet start, I get that burning sensation in my feet. So
Yeah,
yeah.
yeah.
So
Um, if I got it, she's complaining about some sensations that can occur in some moments that are temporary and depending
yeah,
on, for example, the temperature or the season.
yeah.
And for example, you can experience what we call or UTOF phenomena
Okay.
or pseudo relapse, pseudo
So yes,
exacerbations.
yes.
Okay, in pseudo relapse is when you experience some symptoms that, for example, you can have, for example, old relapse about, for example, your vision or your sensation 2 years ago, old relapse, and the symptoms just come back to your body, but is temporary and
Right.
improves spontaneously, and in general are related to some situations, okay?
Okay.
For instance, infection, fever, or even stress. can cause, for example, a pseudo relapse.
Okay.
Okay?
Yes.
Because in those situations, the electrical information don't pass over your neuron because, for
Oh,
example, of the temperature. And regarding Utah phenomenon, would be the same situation, but will be a little faster. Okay,
okay.
some kind of pseudo relapse in general can last. For example, if a secondary to an infection can be, for example, a little longer, and
Hmm.
Utah phenomenon can be in general a little shorter, a little quicker,
Okay, but
and is
but
related
what
to temperature.
but what is this with burning sensation and the flushed skin? Is there any kind of reason why it happens? Like she said, her cheeks become red.
No,
You
no,
know.
that will depend. For example, no, that is other situation. That, for example, we can, for example, in some case, we can call flush.
Yes.
Okay, that can be
Yes.
secondary to some kind of drugs like
Oh.
dimethyl fumarate,
Oh. Okay.
or even, for example, in some case, secondary to Copaxone, but in rare case.
Okay.
It's important to check it out if this symptom is secondary to other situation, to a
Yes.
medication, or if it's secondary to MS. Because
Right.
as I said, in some situation, sensation symptoms can come back during infection, fever, stress, or whatever.
Right. Going to other question, LAJ 1186 has again written about the question we discussed. The virus and struggling to get over it is the best way to fight. So without MS are successfully taking vitamin supplements to help. So like doctor said, you don't need to take any medications or something,
Yes, yes,
you
absolutely.
don't
As I
need it.
said.
Yeah. All you need to do is maintain social distancing. That is the
Yes,
best way.
yes, yes, that's it. It's maintain a healthy and balanced diet.
Yeah. Doctor, there's one message from Dr. Rene Carvajal. I think you will be able to read and answer that. It's again in Spanish. It's Sonata 61, Soy J, Colombia, Trajamos. I'm sorry, I'm sounding funny.
In Spanish,
I have to learn that too.
what was the question? Sorry.
Yeah, I can't read that. I was
Oh,
reading
no,
it.
no problem, no problem. Tell
From
me when you get it.
no, it's in Spanish, so I don't know.
Where is the question?
This is by Dr. Rene Carvajal.
Ah, okay, okay, okay. I'm seeing now. Okay,
Yeah.
okay, okay. Ah, okay. No, 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 no. It's a suggestion to follow. It's not a doubt or question. Renee is a special colleague, is a friend of mine, a
Oh,
colleague
so nice.
that
Okay.
spent almost 1 year in Barcelona with me. Is a big neurologist that is specialized in MS and neuroimmunology. I strongly advise to watch
Um,
their class if you can. Yes,
oh, thank you so
he
much.
he he has a good didactic to explain doubts and questions to his patients.
Oh, that's so sweet, and thank you. Thanks, doctor, for
Yes,
coming.
yes, yes.
Doctor, moving on to next question. Kerrigan 81234 has written, what's the best treatment for severe spasticity? They are suggesting baclofen pump. Is this the right one?
Okay, yes, yes. As I said, when the spasticity is severe, we recommend, besides the oral treatments, like, for example, oral baclofen or tizanidine, or, for example, clonazepam, we can advise baclofen pump. This
Okay.
is a device that is placed on your back and
Oh,
release some amount of baclofen to relieve your stiffness on your legs, for example. And in other case of severe spasticity, we can use CBD cannabidiol as well.
Yeah, if it suits a person, of course.
Yes.
The other question I can see is by Scorpio again. She has RRMS, and when she was diagnosed, unbeknownst to me, I had an acute relapse, and I was curious to know approximately how long before I heard biotin is good for MS. What's your take? Yeah, again, she is referring to the same question. That is biotin good for MS? And are there any medications that can help with cognitive dysfunction?
Okay. As I got it, she is, for example, in the beginning of MS diagnosis and treatments, maybe in the first year, and it's a special moment of MS treatment. But we recommend to follow the recommendation of her neurologist about the best medication with the best risk-benefit profile for her, and follow the other recommendations about diet, exercise, and regarding cognition that she has asked me. It's more prevent new lesions or progression in the future. Okay, we don't have yet any medication that is specific or effective to improve cognition. Repeating some information that is so important, that is before to try any medication to improve memory loss, to improve, for example, loss of attention, you have to make sure if you, for example, are doing exercise, if you, for example, are avoiding fatigue or treating fatigue, or if you are treating mood disorders like depression or anxiety, and if you are sleeping well, okay?
Right.
Only after all these recommendations, we can try some medications to improve cognition. And not everyone will respond to that kind of medications. We have, for example, at least 3 or 4 class of drugs that we can try.
Doctor, there's a patient by the name of Hind Honey, and he's written that he's from Sudan and he can hardly move. So he has a problem with that. That's the only thing he's described, that he can't move much. Maybe he can't walk much.
Where is the question here? I'm not seeing.
Hind Honey. He has just written one statement: I move harder. I'm from Sudan.
Okay, it's hard to move. What about, okay, feet is hard to move. Okay. First of all, we have to make sure if it's a relapse or if it's a symptom that, for example, you have for example, if it's been a long time that you are experiencing the symptom, or it is a new neurological dysfunction. Okay, is the first one. The second one is characterize the profile of this difficulty in moving. If it's, for example, ataxia, for example, that is problem in balance,
yes,
that you can move as you had drunk, or, for example, have a weakness of one leg, okay?
Yeah.
If you have a permanent disability, rehabilitation with physical therapist or other kind of exercise, depending on your disability level, can help you to improve your ability. But for example, you have to make sure, for example, if that is secondary to pain, because some patients can, for example, have difficulty to walk, and that is, for example, because they have pain. And with pain, we, for example, don't walk in a normal way. Yes, it's important to discuss with the neurologist is following this patient.
Yes, I think again you should be exercising a little more and trying to work, discuss with the neurologist anyway.
Yes.
Going ahead with the other question, someone has written, what can help me for walking and balance? Walking and
Okay.
balance is a problem.
Okay. It's important to do to talk with your physical therapist. Okay.
Yes.
There are some specific exercise to improve balance, to avoid falls,
Right.
and to know what is the better, for example, the best device that you need or not. If you need, for example, walker, a cane, or if you don't need,
Right.
and respect your limit. For example,
Yes.
sometimes you can
Listen to
have,
your body. Yeah.
yeah, respect your body. If you have fatigue, you can, for example, make a fatigue diary. For example, you can know the pattern of your, for example, fatigue. If you are more tired in the morning after your work or after eating.
So, this patient has written that doctor gave her methylpyroxasolone to help her walk better.
Okay, that's a kind of steroids that is
Oh,
given, that we give to patients to treat relapse. Okay,
okay.
we can, for
Okay.
example, prescribe oral or IV steroids during 3 to 5 days to accelerate, to speed up the recovery of the relapse. That's not recommended for everyone, only for
Okay.
moderate to severe relapse. If you
Okay.
have, for example, mild relapse, you can, for example, wait for a spontaneous recovery.
Okay. Speaking of the bladder problems, doctor. So lots of patients complain of bladder problems. So Pity Owl has a question again, that are there any kind of medicines to help empty bladder? She probably has bladder problems related to
Yes,
this.
there's a such common of symptom, or the symptom that the patient cannot, for example, control the bladder, or, for example, the patient cannot, for example, and make the bladder empty and can have, for example, more infections. It's important to talk to your neurologist to know the pattern of the symptom, and sometimes to the urologist.
Thank you, doctor, once again. And it
Thank
was
you so
fabulous
much
having
for
you
your
here.
invitation again.
And
Yes,
thank
I
you to
hope to
all your
see
friends
you.
who were there to support the session too.
Okay. Have a
Thank
nice
you.
night in Mumbai. No?
Thank you. Have a nice evening. Bye bye. Take care.
Okay. Bye bye. See
Bye.
you.